Good morning, ladies and gentlemen. I'm Ebenezer Obi from Nigeria. The reason why I have to carry out this research is that I discovered that in Africa, especially developing nations, the economic burden of so many ailments is so much. Even though we have little researches to show this as evidences, but most of the process, my experience in working in the health facilities have shown that this economic burden of treating some ailments are commoner among the poor. It is actually commoner among those people who are engaged in various kind of hard labor jobs. So how do we answer this very question? That's why I have to go into this research to find out the economic burden of low back pain among Quarry workers attending outpatient physiotherapy clinic at a Tertiary Health Institution in Ondo State Nigeria. Alright, now what is the summary? The study was actually carried out in among the Quarry workers who are attending a particular clinic, physiotherapy clinic at the health institution in Ondo State. And as a matter of summary, it was discovered in this work that the cost of physiotherapy represents the highest, as I'm going to show later. And at the same time, that's among the direct costs. And at the same time, the cost of a physician ranked the second among the direct costs, in which the diagnosis ranked the third. All right, I will show this as I go in this presentation. Among the direct costs, I told us that among the indirect costs, the cost being expended on the paid help ranked the highest, and on the overall, this study actually showed that the direct cost of low back pain among Quarry workers, those who are doing Quarry works, actually form the highest among the direct cost, which is 60.6%. All right, what is the problem? The problem of economic burden of healthcare in developing countries like Nigeria, especially among the low social class, mark my word, low social class, and those involved in risky environmental occupation is worrisome and increases out-of-pocket expenses. If we are preaching health care for all, if we are preaching health coverage for all, then we have to consider the out-of-pocket expenses, especially for the low social class, those who are just laboring to get some money to take care of themselves. Must they go ahead to still spend this money on their ailments as a consequence of their occupation? That's a question we need to answer. And of course, limited data is available on this low back pain, especially in developing countries, as it regards the economic burden. All right, the work-related low back pain is a form of mechanical or non-specific low back pain. And of course, low back pain is the most common reported by population. The human body has a center of gravity, and let me quickly inform you: the taller you are, the higher your center of gravity, and the shorter you are, the shorter your level of gravity. So if you are taller, then you are more prone to having low back pain if you expose yourself to more hard labor works. And of course, this controls sort of structures, our bones, our muscles, our tendons, and control their position, the standing, upstanding, sitting, and even laying down. And of course, a closer evaluation of economic burden of low back pain reveals that it is the most common reason. Mark my word, it is the most common reason for activity limitation individuals under the age of 45. It is the most common. And of course, it's the second most common complaint had in physician office. That is to say, if a particular physician is having patients coming in for a particular musculoskeletal ailment, then low back pain rank the second. And of course, it is third leading cause of surgery. And the fifth most common cause of hospitalization. This is critical issue. These are the problems. Low back pain is critical. That means we have to mitigate against low back pain. If we cannot mitigate, then we should mitigate against the high cost out of pocket expenses of this low back pain. And of course, commentaries that sick leaves accounted for about 55% of the total costs. These are critical issues. Let's go ahead. On methodology, this particular research of mine actually engaged 40 patients having low back pain that are Quarry workers, 28 males and 12 females, receiving this therapy at Fuller Medical Center in Ondo State, Nigeria. It was carried out using non-comparable sampling or purposive sampling, and data on economic burden of low back pain and social development information of participants. They were collected by self-developed questionnaire, which the questionnaire was actually reviewed by the experts. And data was analyzed using simple, very simple descriptive statistics of proportion, mean, and standard deviation. Alright, what is the summary of my literature analysis? I will not bore you with detail of literature analysis. I will just tell you that the research of literature was carried out starting with combination of the following terms: the low back pain, the economic burden, the quarry workers, out-of-pocket expenses, direct costs, indirect costs, all together in one word, anywhere in the article. The research was conducted using common web browsers such as Google Scholar, Academic Database. Those are where I got my information to be able to lead me into the gap in knowledge in this particular area. And of course, what is the result? To go straight to the point, I've told us that a total of 40 patients that are having low back pain and are quarry workers who have participated in this particular essential study. Majority of them, of course, were male, because quarry work is a very intensive work, and male are carrying the highest population. And of course, the age group ranging between 30 and 50. A large percentage, mark my word, a large percentage, 62.5% of persons who are between 20 and 30. That is to tell us that this particular age group, they are the ones that are struggling for themselves, and one way or the other, that's their age group. Respondents with primary education accounted for 40%. Primary education, 40%. That is a bit high. That's more than we thought. The majority, 75% of the participants were married. Now, that is very, 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 very essential. If 75% of the participants were married and they have children to cater for, they have school fees to pay, they have food to prepare their homes, they have things to do that has nothing to do with their health, must they go ahead to spend this meager money, this meager income on their lower pay just because they are involved in a particular occupation that is giving them this kind of consequence? Now, their major hypothesis, which is just split into two, is a null hypothesis and the alternative hypothesis. And that I want to know, or we want to know, there will be no significant difference between the direct costs and indirect costs of managing low back pain among quarry workers attending the outpatient physiotherapy clinic of this particular clinic, of this hospital. And of course, that there will be, that's the alternative hypothesis, that there will be a similar difference between the direct costs and indirect costs of managing low back pain among quarry workers that are attending the same clinic of Federal Medical Center or the physiotherapy clinic. Yeah, what is the significance of this study? If this study has shown actually that the out-of-pocket expenses is high in the management of low back pain among this particular group who are struggling to make ends meet, struggling to have some money to spend on their, and yet they have to go and spend on their low back pain. This study will serve as a satellite, of course, into the burden faced by people involved in these hard labor jobs with respect to the treatment of the assisted payment. It will serve, of course, as a yardstick towards providing a possible intervention. We must intervene in their matter. National health insurance is not so popular in Nigeria. It does not even cover this kind of population. Only those who are working in government setting are being covered by the NHIS, which is National Health Insurance Scheme. It doesn't cover this population. So we must have a policy. This particular study is going to help us to form a particular policy or intervention into this particular group. When they develop their low back pain, must they spend their money on it and all the burden comes on them? Of course, these are references. You can access it. You can access the full study on the platform. What's the conclusion? What's the conclusion? Because I want to round up. I don't want to waste our time. The conclusion of this study is that the direct costs, which covers over 60%, out of which the physiotherapy DC was ranked the highest, because physiotherapy is like 63% of the direct cost. And let me quickly tell us, maybe because my primary occupation is I'm a physiotherapist, I've discovered that most of the gadgets, the instrument being used in the physiotherapy department are very expensive. The time you have to spend with a particular patient is very high. So you charge very high, because the more time you spend, the more gadgets in terms of equipment you use, the more skills you use on your patients will determine how you are going to charge. So it's very high, and that this direct cost of therapy is a burden, is burdensome on this particular population. And of course, we have to ask a particular question: is that ethically correct? Is that equity? Is that quality? Is that coverage? Because these are very essential when we are talking of public health. Equity is important among the poor. That means the rich will be able to pay more. They'll be able to pay for their health. When they develop lower pay more than this class of people, they collect so small, and yet they're going to spend so high. As far as physical treatment of the lower pain is concerned, the finding in this study confirmed the popularity. Of course, it confirmed the popularity of out-of-pocket expenses on healthcare in developing countries like Nigeria. Everybody have to go and buy their drugs. You have to pay for your health. Majority in Nigeria have to pay for their health. And this class of people have to pay for their health and lower pain, in which is a continuous management, because there are different causes of lower pain, in which this one is mechanical. The one I'm addressing is mechanical, and its D is an occupational hazard, occupational consequence. If it continues that way, then there is every tendency that they will continue on this trend. We continually subject the citizen, this particular class of people in developing nation, to poverty, instead with the direct and indirect cause of accessing the health care for various ailments. It's not subjected to poverty. More poverty will be in the land. And of course, this ugly situation, because we have to address it, then calls for attention. From all and sundry, every one of us. If the address of universal health coverage, UHC, universal health coverage is trying to address that health is distributed to all without anybody. Everybody, the rich, the poor, the high class, the social class, will be able to address their health without burden on their pocket. Out of pocket expenses is a bane in developing nation, as well as in this class of people. Of reality in low-income countries. This is very important. And of course, what is the future research? Without wasting time, I've told us that this particular study actually centered on out-of-pocket expenses, the direct and indirect cost. I've told us that the direct cost is more than the indirect cost. The direct cost is more than the indirect cost. The direct cost among the direct cost, Physiotherapy rank the highest, which is above 60%. And even direct costs altogether itself is more than 60%. While indirect costs, among the indirect costs, we have spending on the maid, on the assistants, on somebody who have to attend to them, rank also the highest. So this particular, it will help us in formulation of policy on how to alleviate the economic burden of occupational ailment. I said with risky jobs should be considered. This should be considered in Nigeria and possibly in other developing countries, so that these people will be relieved of the tension, of the burden, economic brouhaha that is associated with treatment of their low back pain because of their occupation. It is also pertinent for other interested researchers to carry out more studies in order to explore the economic implication of low back pain on larger population. This is just 40 patients. Let's take it larger. Let's involve more hospitals. Let's involve more health centers. Let's involve more occupations who are exposed to this kind of hard labor. In the study, in the future study, the tentacle of research, or however now, should also be directed and extended to other risky populations, like I said, apart from quarry that can be associated with low back pain. The other possible factor that can be responsible for the low back pain, apart from the occupation, should also be taken into consideration in the subsequent research. This study has told us that out-of-pocket expenses among the quarry workers that are living in a war and they are struggling to make ends meet is so high. It has shown that direct cost is so high, and the physiotherapy is very particular. It has also shown us that indirect cost, they have to have helper who will help them, and they have to be paid. Like I told us, as I showed us previously, about 34,000 naira have to be expended on that alone every month. This calls for attention. This calls for all and sundry. This calls for all policy makers to come and help this population. As I submit to say thank you to you all. Thank you very much.